Hey everyone, it's Dr. Ellie here with her Pod I Heal Kids. Today we are talking about the measles. So, if you don't know, there is a measles outbreak in Spartanburg County, and we in Asheville, North Carolina, are right near Spartanburg County. And even if you're not and you travel, you're going to want to hear all about the measles. So, we're going to go into what is the measles, how to treat the measles, how to prevent the measles, all about the MMR vaccine, everything you've always wanted to know. So, I want you to listen in to this impactful episode, you guys. So, what in the world is even happening in Spartanburg County? So, last I checked, which was I think a day and a half ago, by checking the South Carolina Department of Health public health department website, I was looking into like how many cases are there? What is the situation? So at last count, and it may have gone up since I last counted a couple days ago, there were about 65 cases of the measles statewide and 62 were clustered in kind of the upstate region. What's kind of going on? Schools have had exposures. It's led to like students being quarantined. Emergency vaccine clinics were basically set up in case people wanted to get vaccinated for unvaccinated individuals. Basically, it's following a national trend that the CDC has been watching. So increasing outbreaks just because of less vaccines. So I just want to walk you through all of this because you're not powerless to find out what measles is, how to treat it, what are the natural options, what are the conventional options. And the information here is for a tool for us to walk through together so that you guys can make a decision that feels aligned for your family. So, what in the world is the measles? Okay, so first things first, measles is a very, very extremely contagious virus. It's one of the most contagious ones that we know of. One of the main issues is you can actually catch it even if someone had measles 2 hours prior to the room that you were entering. So, like in doctor's offices, if someone comes in with the measles, we have to close that room and not use it for a full 2 hours because otherwise another patient could walk in and literally catch the measles. So we don't want to infect other people. So it's important to know that if you're looking to like avoid measles, if you have someone who caught it in, your community, like how to protect yourself and your kids. So what are the usual symptoms? So often we'll start with like a very high fever. So if you're in the US, we're usually using Fahrenheit. So 102 Fahrenheit to 104 Fahrenheit. So it can get to be quite high. Kids will start with a cough. They'll start with coryza, which basically means a runny nose. Okay, so you'll start getting cough, you'll start getting runny nose. And then the other thing is they can get conjunctivitis. That's when their eyes kind of turn red and get watery, almost like as if they were having pink eye. And then from there, about 3 to 5 days later, they'll get this rash. Okay. And it's like this pinky, blotchy rash. And it's a rash. It starts on the face and then it starts to spread downward. It's important to know like the rash itself isn't, by itself isn't like necessarily a dangerous thing. It's like the inflammation behind the rash that can strain the child's immune system and cause a lot of problems. And then also the complications. Okay. So complications, I just want to say, you guys, I do not want to scare anyone. I just really want to be honest and also really gentle, but I also want you guys to have all the information so you can make informed decisions. So we're going to put it all out there as far as what can sometimes happen. Okay. So what is common with the measles? Commonly with the rash, with the cough, with the coryza, the conjunctivitis that we just talked about, kids will also get ear infections and diarrhea. So that's very, very common. Now, a more serious complication is pneumonia. And pneumonia is basically an infection of the lung tissue where you get pus and inflammation, filling up the pockets of the lungs, making it difficult to breathe. And so sometimes children that have pneumonia, especially with measles pneumonia, will have to get additional supports. All right. So treatments, heaven forbid, in the hospital on oxygen, that type of thing. Okay. Doesn't always come to that, but that can happen. All right. So on that, like how many times do kids get hospitalized with the measles? Okay. It's about 1 in 5 children that do end up needing hospitalization when they get the measles. It's not a low amount. All right. Another complication that can happen, and again, this is not to scare anyone, this is just to give you the facts so that you can make an informed choice, is encephalitis. And encephalitis is inflammation of the brain. So inflammation of the brain is not a good thing. And we really need to treat it because if you have a severe case, now many children who get encephalitis will recover. That said, some won't. All right. And some will develop long term consequences, such as anything related to areas of the brain that were affected by the inflammation in the brain. So, like motor function, speech, walking, things like that. That would be very, very severe. So, how many kids get encephalitis? It's about 1 in 1,000. So, if you have measles, if 1,000 kids have measles, 1 in 1,000 will get the encephalitis. So, this brain inflammation. And then from there's a spectrum from like full recovery to not recovering at all to having some like long-term sequelae or consequences from the encephalitis, okay? Requiring things like physical therapy, speech therapy, occupational therapy, like a lot of supports to try to get the brain to rewire, okay? Because brains are plastic, so they can kind of rewire. All right. Now, this one may be really hard to hear, you guys. And if this is feeling alarming to you, you may want to turn this off and maybe listen with a friend, a support group. If your child has measles, maybe don't listen and just talk to your doctor directly because this is not information that I want to scare people with. This is really just information for so people can make a decision. Okay. So, how many children die from the infection of measles? So, about if you take 1,000 kids, about 1 in 3 will actually pass on. Okay. So, we just need to know that when we're making decisions. Okay. Now, that said, I do want to say most children do recover fully from the measles, but these risks are kind of why we take the measles seriously, and especially when there's an outbreak. All right. Okay, another hot topic. The MMR vaccine. MMR, what does it stand for? Measles, mumps, and rubella. All right. You can't get them separated. So the companies just make it as an MMR. So it used to be, I think, where you could get like mumps as a separate vaccine from measles or rubella separately. That's not the case anymore. You have to get them all together. So it is an extensively studied vaccine. According to the CDC, one dose of the MMR vaccine is about 93% protective against the measles, which is good news if you're in an outbreak area. Typically, we give it at 12 months old. That said, if you are in an area where there is an active outbreak, you can get the first dose much sooner, as early as 6 months old. So you'll want to check with your local public health department about that. If you get the second dose, it's about 97% protective against the measles. And typically, again, we'd give a second dose at age 4. Okay, so there's those two different times that we give the measles vaccine, so the MMR vaccine. Another thing to think about is if you are in an outbreak area, sometimes you'll actually end up needing 3 vaccines. So, like, let's say you got one early between 6 months and 12 months, then oftentimes people will recommend doing the other 2 as well. So, just kind of knowing that there may be an extra one if you are needing to get that early vaccine or you're wanting to. Okay, so what are the side effects of the MMR vaccine? The common things that happen, and this happens with many shots, is like a mild fever. So something a little bit elevated, 100.4, 101, somewhere kind of in that range is pretty common. Obviously, we're doing an injection, so you can get a very sore arm. You might get like a red spot around where we inject because the tissue can become a little bit inflamed because you're introducing a needle to that area. And then the rare side effects, there can be a brief fever related seizure. So this is typically children that are predisposed to getting febrile seizures. If they get a sudden onset fever after vaccination from MMR, in some cases, this is extremely rare, you guys, they may have a febrile seizure. That doesn't usually lead to long-term consequences. Okay. So like brain damage or something awful like that. Another one is a temporary drop in the platelet count. Platelets are like these little things in the body that basically, I don't know, like plug up little cuts and things like that. So it's kind of what they do. We never want that to get dangerously low because it can cause severe problems. But as a temporary little drop isn't too harmful, okay? Usually these things will resolve without like long-term harm, but if your child has platelet issues, this may be something that you need to ask about, especially if they have something like ITP or TTP, which we don't have time to go into all of those platelet disorders, but if you've heard those words before, then you probably know your child has them. Who should not get the MMR vaccine? Okay. So if your child has significant immune compromise, like they're very, like they have a very bad immune deficiency, then that's not a good time for your child to get a MMR vaccine. Okay. Also, if they are immune suppressed from medications, that's not a good time either. So you'll want to clarify with your doctor about, what medications they're taking, like how severely they're immune depressed. Like, is it a good time to get the MMR vaccine or not? If they're taking immune suppressive medications. Also, people who are going through some certain cancer therapies, it's not a good time. So you just want to talk that over and see if, your child is on a therapy that they should not be getting the MMR. I just want to say, like, if you have been spacing vaccines or you've been feeling kind of thoughtful about timing and you're kind of taking it intentionally, I just want to, ensure that there's still flexibility to make, a decision about MMR that feels right to you. And that said, while not a substitute at all for vaccination, there are some gentle supports that you can do. And those would be vitamin D, and that helps kind of support the immune system. Milk thistle, that helps with detox. Probiotics, which is always an amazing gut support, immune supporter. Epsom salt baths, just to kind of detox the system, and also thuja, which can help detox. If you are in a room with people with measles or they were in the room with you like within 2 hours, like it's not going to prevent you from getting measles. So I just want to put that on there, but they are like minor things that you can do or mildly helpful things that you can do. Okay. Now, vitamin A, there's like a whole rabbit hole with that. We'll use it like really if your child is actively infected and only under certain circumstances. A lot of the studies were to do with people that were deficient in vitamin A, which most of us aren't. If you have a severe infection, that's not, you need more additional treatment. Okay. I just want to emphasize all of these like integrative approaches and everything. If you guys are in the area in or around Asheville, North Carolina, my practice is Middle Path Integrative Pediatrics. And if you don't know me, I'm Dr. Ellie, and I'm more than happy to bring you on as a member and we can talk about what's going on personally. And if you are part of my practice already, then obviously reach out and make an appointment, and Carly or Heidi can set you up for an appointment because they're amazing. Okay, let's talk about some red flags, like when to come in for care. I definitely want you guys, if your child is having a high fever, if they're having like fever and a rash, you need to see someone. Make sure this isn't measles, especially in some of these areas, like our area in Spartanburg County, so just south of Asheville. That's concerning, especially if your child isn't vaccinated, that it could be measles, and you just want to make sure and get checked and find out what's going on. If it's not measles, there's plenty of other things it can be where kids get fever and rash. So I don't want you guys to panic. There's plenty of things that kids get rashes from. Viral exanthems, roseola, there's a whole boatload. So it doesn't have to be measles, but you just want to find out what's going on because it may be appropriate to stay in communication with your doctor to isolate so you're not infecting other individuals. If there's anybody who's like immune suppressed or pregnant, like you'll want to know, so you can take appropriate precautions. And then also just so that you can make sure that you're getting the right advice. If heaven forbid things do get worse, that you have some supports. Okay. Now, things that would make me say, oh my goodness, I need you to go to the urgent care or ER right now. Your child's got fever, rash, and then now they're not breathing well. Okay, I need you to go in if your child is not breathing well. Okay, so this can look like a lot of different things. It can look like they're sucking in under their rib cage to breathe, so retractions. It can look like head bobbing. That's a really late sign. Call 911 if you see that. Okay, it can look like their nasal passages are flaring. If you see that, I need you to go see someone. And in babies, especially, they might make a grunting sound. So if you're hearing sounds that don't sound like your normal baby sounds, I need you to go in and see someone, okay? Because we need to make sure that your babies can breathe and your children can breathe. Another thing is lethargy. So if your kid's having symptoms and one of them happens to be lethargy, what are we talking about? This is medical lethargy. So this is like your child cannot be stirred or they're not easily stirred from a sleepy state to interact with you, to play, to eat their food. Okay. So it doesn't mean like, oh, they're a little bit tired. Well, like when you get a cold and you have the flu and you just are tired. This is like, oh my goodness, I really can't stir them. That's like go to the ER right now or call 911. Okay. Dehydration. This is not a good one. Kids can get dehydrated really fast, especially littles. Okay. Infants who are having less than 2 to 3 soaked diapers in 24 hours, please go to the emergency room. I don't care what the illness is, measles or anything else. And really, the difficulty breathing, the lethargy, again, measles, anything else, I just need you to go to the ER, okay? Because we need to get checked. And then in older kids, what else to look for would be the inside of their mouth is dry. They're not urinating well. They're not able to keep fluids down. So let's say they're vomiting and they can't keep it down, or they're having so much diarrhea that they're not able to intake a lot of fluid. Lethargy can be a sign of dehydration. And then capillary refill. Reflex. I love that. This is a good one. You can do it. Sometimes it's hard to appreciate, but you can either pinch the finger of your child or baby or pinch their cheek. It should turn from pink to white very briskly. You can kind of see on mine maybe a little bit, but try at home. Well, I guess I have pink skin tone, but not everyone does. But okay, on me, my nail bed is pink. And so it goes pink, white, pink really quickly. That's a good thing. Whatever skin tone you have, it should be that skin tone, paler skin tone, back to your normal skin tone very quickly. Okay. And if it's not doing that, then someone needs to check. And the length of time we're worried about is 3 seconds or more. Okay. And it's hard to count. So if your kid doesn't seem like they're drinking well and you're worried about that, have someone take a look. Okay. Seizures, I think most people know this. If your child's having convulsions, by all means, call 911 or go to the emergency room. And to go along with the difficulty breathing, coughing, and severe wheezing, that is another sign your child's not breathing well. So make sure you go to the urgent care ER for that as well. I also want you guys to know you're not alone. Like, I'm here. I'm your integrative pediatrician in Asheville, North Carolina at Middle Path Integrative Pediatrics. There's plenty of amazing pediatricians out there who are ready to support you and help you to understand what is measles and help you talk through the MMR vaccine, which I know can be edgy and scary for a lot of people. That said, we're in an outbreak, so there may be some decisions that may be different than what you would have made a few months ago. So it's important to just chat about that if you're unsure. Okay. If you guys are local, I want you to know where you can go get vaccinated. Okay. So if you don't have a doctor, you're not sure what to do, where to go, you're in a hurry, you're confused, I want you to reach out to Buncombe County Health Department. Their number is 828-250-5096. Again, 828-250-5096, and it's the Buncombe County Health Department. They have walk-in hours for injections Monday, Wednesday, Friday, 8 to 11:30 a.m. and Tuesday, Thursday, 1 to 4:30 p.m. I believe you can also make an appointment. So don't feel shy if you aren't in my practice or you don't have a doctor. You can see them to get vaccinated if that's something that you're choosing to do, or go talk to them about vaccination. That's another thing that you can do. And if you don't have a pediatrician, or you're looking for someone that you feel comfortable talking to about vaccines and getting all the different points of view and helping you make a decision without shame or blame or judgment, I would love you guys to join my practice. Again, I'm Middle Path Integrative Pediatrics. And whether or not you're doing the MMR or not, I am here to support you and help your child be as healthy as possible, and just make sure you guys have all the information so you can make an informed decision, especially in times like this where there is an outbreak. Okay. But I would love you guys to join my practice. And if you want someone who blends integrative medicine, so holistic medicine with evidence-based care, please go to my website, middlepathintegrativepediatrics.com, set up that meet and greet, or give us a call, 828-222-3781, and they can help you. Carly and Heidi are more than happy to get you scheduled, and I would love to meet you. I want you guys to know that if you've listened to this, you are thoughtful, you're attentive, you're an amazing parent, and simply by listening today, you have found information that will help you make the best decision for your family. And again, my goal was never fear. It's clarity, empowerment, and grounded next steps. And with that, I'll just say, wishing you well, and reach out for that meet and greet if you have further questions, or an appointment if you're my patient already. All right. Bye, guys.